If you've ever wondered why clients don't come back after their first session, you're not alone. Most therapists miss at least one of the 5 key factors that determine whether a client becomes a regular or disappears forever. I'm Dr. Ben Benjamin, and today we're going to break down what keeps clients coming back and what drives them away. 1. Low skills. The practitioner has very poor technical skills. The massage was too forceful and hurt, or the practitioner used very light pressure and it felt like nothing was really happening. This is often a therapist who's disengaged. Their attention is elsewhere. This is easily remedied. A practitioner with low skills should find a massage therapy teacher to work with them privately. The best way to train excellent practitioners is by having the student work on the teacher. When I began training practitioners in massage therapy, I had every student work on me in a private lesson 2 to 3 times per month. The kind of feedback you can give is head and shoulders above what you can learn in a class where you're just watching the people work and not feeling what the person is actually doing. 2, low energy. A physical energy is transmitted through the practitioner's hands to the client's body in every massage. Clients and even therapists are often not necessarily aware of this, but it happens nonetheless. Think of it this way. When some people touch you, it feels really good, and you want them to keep touching you. When others touch you, it doesn't feel like much. It's like they're absent. And there's a third category. Occasionally, when someone touches you, it doesn't feel good at all, and you would like them to stop as soon as possible. This does not happen very often in massage, but occasionally it does. When I owned my massage school, part of the screening process was to have a new student work directly on a teacher very soon in their process of learning. In some cases, the student's hands would be very cold. In others, you sense an internal shaking, and in a few, you sense uncomfortable aggression. Some students could be trained to overcome these issues, but others cannot. The student with shaking and freezing hands would be counseled out of the program at my school very early on. Low energy is a more difficult problem to correct. First, you would have to assess what the problem really is. It could be lots of chronic muscle tension in the practitioner's body, which would require some body work over a period of time. It could be a lack of interest. The person didn't really want to do this as a profession, but it was the best they could do under the circumstances. In this case, I'd recommend searching out a new profession. It could also be an emotional issue that would require some psychological therapy. I remember a student, let's say her name is Susan, from a number of years ago. She had excellent technique, but there was very low energy in her hands, which were sometimes cool or even cold. I suggested that she get some intensive therapy, which she did for many months. I was shocked because when she came back, her hands were not cool or cold. They were actually hot. She went on to have a wonderful career. 3, disconnected. Some massage therapists can be disconnected or disengaged from their work. To the sensitive client, this feels like the therapist would rather be somewhere else. Most clients would not be able to identify this, but they just don't like the massage, and they don't know why, but they never return. Maybe you are disengaged because you're doing the same thing over and over again, and it's boring. I wouldn't want to be doing that. I like feeling like a detective, treating each client's case differently, assessing for indicators of what is the real problem. When I can find what other health practitioners have overlooked, it feels very exciting. I need to work with each person differently. If my goal is to resolve the pain they've felt for many years, that's what I want to do. If therapists are disengaged as they work with clients, it's likely that the modality that they're practicing doesn't really excite them. In this case, I suggest exploring different types of bodywork. There are at least 300 different bodywork approaches and trainings. For these therapists, I would suggest going to many different practitioners to experience all sorts of approaches to massage and body work. If they find a modality they like, they should get fully trained so they're engaged and really excited about the work that they're doing. I offer extensive training in pain assessment and treatment. If you're interested in this modality, you can check out my subscription service for free for 7 days. Just click on the link in the description below to get started. 4. Poor communication skills. Some people you meet, you just like being with them and you look forward to seeing them again. Others you don't find so engaging and you don't develop a relationship with them. Poor communicators don't know how to engage with people. They're withdrawn and keep to themselves, and it's difficult for them to make friends with new people. Good communication is an ability some people have and others don't, but it can be developed. Sometimes that requires therapy if there are emotional blocks to connecting. Other times, it just takes training in communication skills to make a difference. If the therapist has poor communication skills, there are many books on communication and several trainings practitioners could take to improve their communication skills. I teach a system called SAVVY, which stands for the System for Analyzing Verbal Interaction. This system teaches you how to understand the anatomy of communication, why things go well and why they don't. I've co-authored a book called Conversation Transformation, which you can read to see if you like the approach. There are trainings that occur in various parts of the country and in different parts of the world. Another popular book and approach is called Nonviolent Communication. Another is Difficult Conversations. Find an approach that appeals to you. 5. No improvement. If a client comes because they are experiencing pain and they feel you are not knowledgeable about this area and experience no improvement, they often don't return. After a month or so, if a client's pain is not improving, I send them to someone who I believe can help them better than I can. My Anatomy in Action subscription service is an excellent way to gain skills in the assessment and treatment of pain and injury problems. Training in this area makes a huge difference. The ability to assess exactly why a person has pain and know which treatment to apply is an invaluable skill for a successful practice. If people are getting better, they keep coming back and they recommend their friends and colleagues. Keeping clients isn't luck. It's about skill, insight, and connection. With Anatomy in Action, you'll gain the tools to confidently assess and treat pain, strengthen client trust, and build a thriving practice. Plus, you'll join me every month for a live Q&A session where we tackle your toughest cases together. Start your free 7-day trial now by clicking the link below. Thanks for watching, and I'll see you in the next video.